Hello, I'm Dr. Stephen Robinson from BOH Dental in Brisbane City, and today I'd like to talk to you about common myths and misconceptions in root canal treatment. A lot of people who present to the surgery with a root canal problem will be in pain. However, once we have diagnosed what the problem is and given them a local anaesthetic, usually the procedure can be carried out without any significant pain or discomfort. Occasionally, after the procedure has been completed, when the effects of the local anaesthetic are wearing off, then there will be some discomfort, but usually that's in the form of mild tenderness that can be controlled with across-the-counter pain medications. Put simply, root canal procedures don't really deserve the bad reputation that they've got. Root canal treatment is highly successful. We know from the literature that upwards of 90% of patients will retain their tooth for many years after the treatment has been completed. There are other big advantages to having root canal procedures compared to extracting the tooth. We retain the surrounding bone and gum tissue, which is always beneficial. We also know from the literature and from experience that the vast majority of root-filled teeth that fail, it's not the root canal filling itself that fails, it's the structural integrity of the tooth that's the problem. The alternatives to root canal is normally to extract the tooth and perhaps replace it. Often this is with a denture, a bridge, or an implant. The huge advantage of having a root canal procedure is that you get to retain your natural tooth. That of course keeps open all of those other options for some point in the future, so that if the root canal treatment in the long term or fails, or the tooth itself fails, then you have other options open to you. If you're having pain from a tooth, often people will have had others tell them of their unpleasant experiences with root canal. I would just like to reassure you that in the vast majority of cases, root canal treatment itself can be carried out in a painless way, and you get to keep your tooth in the long term. And from my point of view, it's an incredibly satisfying situation where someone comes in pain and will leave and be very pleasantly surprised in the majority of cases by how things have gone.